Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Tirzepatide for heart failure with preserved ejection fraction and obesity. Background. Obesity increases the risk of heart failure with preserved ejection fraction. Tirzepatide, a long-acting agonist of glucose-dependent insulinotropic polypeptide and glucagon-like peptide 1 receptors, causes considerable weight loss, but data are lacking with respect to its effects on cardiovascular outcomes. Conclusions. Treatment with tirzepatide led to a lower risk of a composite of death from cardiovascular causes or worsening heart failure than placebo and improved health status in patients with heart failure, with preserved ejection fraction and obesity. Continuation versus interruption of oral anticoagulation during TAVI. Background. 1/3 of patients undergoing transcatheter aortic valve implantation, TAVI, have an indication for oral anticoagulation owing to concomitant diseases. Interruption of oral anticoagulation during TAVI may decrease the risk of bleeding, whereas continuation may decrease the risk of thromboembolism. Conclusions. In patients undergoing TAVI with a concomitant indication for oral anticoagulation, peri-procedural continuation was not non-inferior to interruption of oral anticoagulation during TAVI, with respect to the incidence of a composite of death from cardiovascular causes, stroke, myocardial infarction, major vascular complications, or major bleeding at 30 days. Lentiviral gene therapy with CD34 plus hematopoietic cells for hemophilia A. Background. Severe hemophilia A is managed with factor VIII replacement or hemostatic products that stop or prevent bleeding. Data on gene therapy with hematopoietic stem cell, HSC-based expression of factor VIII for the treatment of severe hemophilia A are lacking. Conclusions. Gene therapy for hemophilia A, with the use of lentiviral vector transduced autologous HSCs, resulted in stable factor VIII expression, with factor VIII activity correlating to vector copy number in the peripheral blood. CRISPR-based therapy for hereditary angioedema. Background. Hereditary angioedema is a rare genetic disease characterized by severe and unpredictable swelling attacks. NTLA-2002 is an in vivo gene editing therapy that is based on clustered regularly interspaced short palindromic repeats, CRISPR-associated protein 9. NTLA-2002 targets the gene encoding kallikrein B1, KLKB1. A single dose of NTLA-2002 may provide lifelong control of angioedema attacks. TOTS conclusions. NTLA-2002 administered in a single dose of 25 mg or 50 mg reduced angioedema attacks and led to robust and sustained reduction in total plasma kallikrein levels in patients with hereditary angioedema. These results support continued investigation in a larger phase 3 trial. Next, we will be discussing articles from Journal of American Medical Association. Health system, community-based, or usual dementia care for persons with dementia and caregivers. The D-CARE randomized clinical trial. Question. What is the comparative effectiveness of health system-based, community-based, and usual dementia care on clinical outcomes for persons living with dementia and their caregivers? Findings. In this randomized clinical trial that included 2,176 dyads of patient and caregivers, patient behavioral symptoms and caregiver strain over 18 months were not significantly different between a health system-based and a community-based care intervention, nor between either active intervention and usual care, meaning in this randomized clinical trial of dementia care programs, There were no significant differences between a health system-based versus a community-based care intervention, nor between either active intervention versus a usual care control group, with respect to patient behavioral symptoms and caregiver strain. Palliative Care Program for Community-Dwelling Individuals with Dementia and Caregivers. The In Peace Randomized Clinical Trial. Question: among community-dwelling individuals with moderate to severe dementia, does a dementia care management program with integrated palliative care reduce patients' neuropsychiatric symptoms? Findings. In this randomized clinical trial that included 201 patient caregiver dyads, the mean neuropsychiatric inventory questionnaire, NPIQ, severity score, range, 0 to 36, at 24 months, was 9.15 in the dementia palliative care group, and 9.39 in the usual care group, and there was no significant difference in the rate of change in NPIQ severity from baseline between groups over time, meaning in this randomized clinical trial, a dementia care management program with integrated palliative care did not significantly improve patients' neuropsychiatric symptoms. Next, we will be discussing articles from Annals of Internal Medicine. The association of Epstein-Barr virus donor and recipient Serostatus with outcomes after kidney transplantation. Background. Prior studies indicate that 1% to 4% of Epstein-Barr virus, EBV seronegative recipients of EBV seropositive donor, EBVD+/R-, kidneys develop post-transplant lymphoproliferative disorder, PTLD. However, these estimates are based on limited data that lack granularity. Conclusion. Compared with previous studies, this study showed that EBVD+/R- kidney recipients face a 5 to 10-fold higher cumulative incidence of PTLD. Strategies to mitigate the PTLD risk are urgently needed. Next, we will be discussing articles from British medical journal Cubink Open Access. Frozen versus fresh embryo transfer in women with low prognosis for in vitro fertilisation treatment, pragmatic, multicentre, randomized controlled trial. Objective: to test the hypothesis that a freeze-all strategy would increase the chance of live birth compared with fresh embryo transfer in women with low prognosis for in vitro fertilisation, IVF, treatment. Conclusions: fresh embryo transfer may be a better choice for women with low prognosis in terms of live birth rate compared with a freeze-all strategy. The treatment strategies that prevent fresh embryo transfers, such as accumulating embryos with back-to-back cycles or performing routine pre-implantation genetic testing for aneuploidy, warrant further studies in women with a low prognosis. Next, we will be discussing articles from Lancet. Coronary CT angiography guided management of patients with stable chest pain, 10-year outcomes from the Scott Hart randomized controlled trial in Scotland. Background. The Scottish Computed Tomography of the Heart, Scott Hart, trial demonstrated that management guided by coronary CT angiography, CCTA, improved the diagnosis, management, and outcome of patients with stable chest pain. We aimed to assess whether CCTA-guided care results in sustained long-term improvements in management and outcomes but interpretation. After 10 years, CCTA-guided management of patients with stable chest pain was associated with a sustained reduction in coronary heart disease, death or non-fatal myocardial infarction. Identification of coronary atherosclerosis by CCTA improves long-term cardiovascular disease prevention in patients with stable chest pain. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Incidence of medication-related osteonecrosis of the jaw in patients with breast cancer during a 20-year follow-up. A population-based multicentre retrospective study. Purpose. Medication-related osteonecrosis of the jaw, MRONJ, is one of the most important toxicities of anti-resorptive therapy, which is standard practice for patients with breast cancer and bone metastases. However, the population-based incidence of MRONJ is not well established. We therefore performed a retrospective multicenter study to assess the incidence for a whole Austrian federal state, Tyrrell. Conclusion. MRANJ incidence in breast cancer patients with bone metastases was found to be considerably higher, especially for patients receiving denosumab, when compared with available data in the literature. Additionally, patients treated with denosumab developed MRANJ significantly earlier. Here are the articles from Journal of Hepatology. Patient-reported outcomes in chronic hepatitis delta. An exploratory analysis of the Phase 3 MER301 trial of bulevirtide. This study reports the first data on the health-related quality of life, HERCL, of patients with chronic hepatitis delta, CHD, receiving bulevirtide, BLV. Patients who received BLV versus no therapy for 48 weeks had improved physical and hepatitis-related quality of life. BLV 10 mg may improve physical and general HERCL for patients with CHD who have advanced liver disease. BLV was well tolerated, as supported by the maintenance and improvement of overall HERCL. Long-term outcome following liver transplantation of patients with ACLF grade 3, 5 and 10-year patient and graft survival rates were not different in patients with ACLF3 compared to matched controls. Within 5 years, 90% of deaths occurred before the end of the second year. Leading causes of death in patients with ACLF3 were infection and cardiovascular events. UCLA-FRS and Charlson Comorbidity Index were associated with the 10-year risk of death. An age-adjusted Charlson Comorbidity Index greater than or equal to 6 was associated with a 10-year survival rate less than 30%. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Myosin VB traffics P-glycoprotein to the apical membrane of intestinal epithelial cells. Background and aims. The xenobiotic efflux pump P-glycoprotein is highly expressed on the apical membrane of the gastrointestinal tract, where it regulates the levels of intracellular substrates. P-glycoprotein is altered in disease, but the mechanisms that regulate the levels of P-glycoprotein are still being explored. The molecular motor myosin VB, MYO5B, traffics diverse cargo to the apical membrane of intestinal epithelial cells. We hypothesized that MYO5B was responsible for the delivery of P-glycoprotein to the apical membrane of intracytes. Conclusions. Collectively, these data demonstrate that MYO5B is necessary for the apical delivery of P-glycoprotein. Here are the articles from Clinical Gastroenterology. Prevalence and predictors of follow-up endoscopic biopsy in patients with celiac disease in the United States. Objective. To characterize the frequency and predictors of follow-up endoscopic biopsy in patients with celiac disease. Background. The utility of routine follow-up biopsy in patients after a diagnosis of celiac disease is uncertain, especially in patients whose symptoms resolve on the gluten-free diet. Conclusions. Follow-up duodenal biopsy is performed in a substantial minority of U.S. patients with celiac disease. Adult age and increased comorbidity burden were associated with a greater likelihood of follow-up biopsy. Just under half of follow-up biopsies are performed for routine surveillance, in the absence of persistent symptoms. Do patients with NASH-related cirrhosis have better overall survival compared with other etiologies of cirrhosis? A population-based study. Goals and background. Non-alcoholic steatohepatitis, NASH, is a leading cause of cirrhosis. We aim to explore the clinical outcomes of NASH cirrhosis compared with other etiologies of cirrhosis. Conclusions. Patients with NASH cirrhosis probably have better 3-year overall survival than other etiologies of cirrhosis. This is an interesting finding, as patients with NASH are older and have more comorbidities. Improved survival can be partly explained by a higher probability of liver transplantation and improvements in cardiovascular outcomes. Next, we will be discussing articles in the field of rheumatology. Associations of fire, smoke, and other pollutants with incident rheumatoid arthritis and rheumatoid arthritis-associated interstitial lung disease. Objective. Determine whether pollutants such as fire smoke-related particulate matter smaller than 2.5 microns, PM2.5, are associated with incident rheumatoid arthritis, RA, and RA-associated interstitial lung disease, RA-ILD. Conclusion. Increased fire smoke PM2.5 was associated with RA-ILD, while NOx, ozone, and PM10 were associated with RA risk. Thus, air pollution may increase the risk of RA and RA-ILD. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Efficacy and safety of finerenone across the ejection fraction spectrum in heart failure with mildly reduced or preserved ejection fraction, a pre-specified analysis of the FINEARTS-HF trial. Background. The effects of treatments for heart failure, HF, may vary among patients according to left ventricular ejection fraction, LVEF. In FINEARTS-HF, finerenone trial to investigate efficacy and safety superior to placebo in patients with heart failure, the nonsteroidal mineralocorticoid receptor antagonist finerenone reduced the risk of cardiovascular death and total worsening HF events in patients with HF, with mildly reduced or preserved ejection fraction. We examined the effect of finerenone according to LVF and FINEARTS-HF's inclusions. In patients with HF with mildly reduced or preserved ejection fraction, finerenone reduced the risk of cardiovascular death and worsening HF events, irrespective of LVFE. Here are the articles from Journals of the American College of Cardiology. Machine learning-based prediction of death and hospitalization in patients with implantable cardioverter defibrillators. Background. Predicting the clinical trajectory of individual patients with implantable cardioverter defibrillators, ICDs, is essential to inform clinical care. Machine learning approaches can potentially overcome the limitations of conventional statistical methods and provide more accurate, personalized risk estimates. Conclusions. The RF-SLAM algorithm accurately predicted all-cause mortality and death/HF hospitalization at 3 months and 1 year during the first 5 years of device implant, demonstrating good internal and external validity. Prospective studies and randomized trials are needed to evaluate model performance in other populations and settings, and to determine its impact on patient outcomes. From JAMA Cardiology. Artificial Intelligence Enhanced Electrocardiography for Prediction of Incident Hypertension. Question. Can an electrocardiography, ECG-based artificial intelligence risk estimator for hypertension, AIR-HTN, predict incident hypertension, and stratify risk for incident hypertension-associated adverse events? Findings. In this prognostic study, including an ECG algorithm trained on 189,539 patients at Beth Israel Deaconess Medical Center, and externally validated on 65,610 patients from UK Biobank, AIR-HTN predicted incident hypertension and stratified risk for cardiovascular death, heart failure, myocardial infarction, ischemic stroke, and chronic kidney disease, meaning results suggest that AIR-HTN can predict the development of hypertension and may identify at-risk patients for enhanced surveillance. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Causal association between BMI and polycystic ovarian syndrome. Bidirectional 2-sample Mendelian randomization study. Objective. This study aims to explore the causal effect of body mass index, BMI, on polycystic ovarian syndrome, PCOS. Conclusion. The MR analysis furnished compelling evidence suggesting a causal relationship between elevated BMI and the risk of PCOS, as well as indicating that the severity of PCOS may contribute to elevated BMI levels. Here are the articles from Diabetes Care. Glycemic and psychosocial outcomes of advanced hybrid closed-loop therapy in youth with high B1C, a randomized clinical trial. Objective. To determine the efficacy of advanced hybrid closed-loop, AHCL, therapy in a high-risk cohort of youth on continuous subcutaneous insulin infusion, CSII, with or without continuous glucose monitoring, CGM, with suboptimal glycemia, see inclusions. AHCL should be encouraged in youth with suboptimal glycemia, as AHCL improves glycemia. However, psychological support remains vital, as technology alone may not be able to reduce the burden of diabetes care in this subgroup. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Longitudinal changes in maximal forced inspiratory flow and clinical outcomes in patients with COPD background. COPD primarily impairs expiratory flow due to progressive airflow obstruction and reduced lung elasticity. Increasing evidence underlines the importance of inspiratory flow as a biomarker for selecting inhaler devices and providing ancillary aerodynamic information. Research question: do the longitudinal changes in maximum forced inspiratory flow, FIFA-max, influence acute exacerbations and lung function decline in patients with COPD? Interpretation. This study showed that the longitudinal changes in FIFA are associated with clinical outcomes in patients with COPD. Patients with increased FIFA-max experienced a lower rate of severe exacerbations and a slower decline in lung function. These findings suggest the potential benefits of optimizing inspiratory flow in COPD management, although further studies are needed to confirm these observations due to potential confounding factors. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Toll-like receptor 9 inhibition mitigates fibroproliferative responses in translational models of pulmonary fibrosis. Rationale: idiopathic pulmonary fibrosis, IPF, is a fatal lung disease for which current treatment options only slow clinical progression. Previously, we identified a subset of patients with IPF with an accelerated disease course associated with fibroblast expression of toll-like receptor 9, TLR9, mediated by interactions with its ligand mitochondrial DNA. Objectives: we aimed to show that TLR9 activation induces fibroproliferative responses that are abrogated by its antagonism by using two commercially available indirect inhibitors and a proprietary selective direct small molecule inhibitor. Conclusions: in this novel study, we found that direct TLR9 inhibition mitigates fibroproliferative responses in preclinical models of pulmonary fibrosis. Our work demonstrates the therapeutic potential of direct TLR9 antagonism in IPF and related fibrotic lung diseases. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Sodium glucose cotransporter 2 inhibitors and kidney outcomes across the spectrum of kidney disease, a systematic review and meta-analysis. The effect of sodium glucose cotransporter 2 inhibitors in preventing kidney outcomes in populations at lower risk of kidney disease remains uncertain. Pooled data from randomized controlled trials show that sodium glucose cotransporter 2 inhibitors prevent kidney outcomes across the spectrum of kidney disease risk. Cost-effectiveness of empagliflozin in CKD with or without albuminuria. Empagliflozin is cost-effective for the treatment of CKD in patients with an urine albumin to creatinine ratio of 30 mg/g or more. Empagliflozin is not cost-effective for the treatment of CKD in patients with an urine albumin to creatinine ratio less than 30 mg/g. Here are the articles from Kidney International Reports. Randomized trial demonstrating no translocation of intact intestinal bacteria during hemodialysis or hemodiafiltration. Introduction. The low incidence of intradialytic hypotension, IDH, in high-volume, HV, hemodiafiltration, HDF, may help in maintaining gut perfusion during treatment. Preservation of gut endothelial integrity would limit or prevent bacterial translocation and subsequent systemic inflammation, which may contribute to the low mortality rate in HV-HDF. Conclusion. From this study we conclude as follows. I. Circulating Madonna could not be demonstrated. 2. In the crude analysis, A similar APR was noted in all modalities. Individual markers remained stable or declined after correction for hemoconcentration. And 3. Because neither bacterial translocation nor an APR was observed in either modality, it is highly unlikely that the superior survival of HV-HDF is explained by a superior preservation of gut integrity.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.